So what we discussed in this today's presentation, we discussed the appraisal of therapy articles, and in our guide in the appraisal process was the center of EBM criteria for critical appraisal. How were the criteria? We had three criteria to consider. One was, is it validity? Then the second, is it important or strong? And third, is it applicable? Are our valid and important findings applicable to our practice? But before that, in my very early slide, I showed you that the therapy articles make up the vast majority of scientific research, clinical research in today's world. Then I explained to you what intention to treat means, and you should be able to differentiate the three options. One is the participant is not expected to take the experimental medication, but or intervention, and he's switching to the control group. The second option is he's dropping out, he is not appearing in the control. And the third one is you analyze him in the group in which he was. And we mentioned in this regard the intention to treat, on treatment, or per protocol definitions. And lastly, I had some slides on the applicability of the valid and important findings to our daily practice, and some guidance for which you can use to decide whether you will apply these findings, these suggestions, these conclusions to your own practice or not. So thanks for watching, and hope to meet you in another presentation. Bye-bye.